Hello, my dear audience. My topic of presentation today is total hip replacement and physiotherapy. I'm a little biased towards physiotherapy when I said physiotherapy protocol regarding total hip replacement because I'm a physiotherapist specialized in neurosciences and 15 years of experience in the field. So I'm going to add on some clinical pearls into the presentation, also the recent advances. So you can ask me questions at the end of the presentation and I'll be available on social media also answering the questions regarding the same topic. So why did I choose this presentation? Because total hip replacement is very common surgery and it is the surgery of the century. When we go back to the history of this surgery, we find that this surgery was started in 1800. So I'm going to start sharing my screen so that it will be visible for you. I'm going to answer all of your questions in this presentation, what to do and what not to do after the total hip replacement, a physiotherapy perspective, what best should we do in a long wait of the hip replacement surgery, and preoperative and postoperative total hip replacement protocol with the recent advances. Is the surgery, success of the surgery is in my hand? How long the life of prosthesis or a metal implant? We can increase the lifespan or success of the life of prosthesis. And I'm going to share some top secrets about the post-surgery rehabilitation. So let's begin. Let's begin with our favorite topic, is why this surgery is very important. The hip joint is very versatile joint and it gives you stability, mobility and flexibility. Also, it causes a shock absorption when you walk or high impact activity. So here is the thing, when we lose stability, mobility and flexibility of this joint, that is an alarming factor that you have to consider. Go get checked by the doctor, go get checked by the physiotherapist and find out what could be the reason behind it. We were talking about the total hip replacement surgery when the attempt was done in 1891, which is 130 years ago. That was a first implant, was a glass implant, and then they moved on to the metal implant. Because glass implant, they found that it couldn't do a shock absorption, and with light to moderate heavy activities, the glass started shattering in people's body. Then they come up with the metal implant, and now the surgery has advanced to the level that they have three components. So there is an acetabular component, then there is a femoral component, and there is a shock absorption cartilage component as well. Why total hip replacement surgery have to consider? Because there are common causes to it, that the hip degeneration or arthritis or a fracture due to the fall. And when this kind of injury to the joint happens, it is likely that multiple times you can get involved in such accident because you get prone to fall again and again. So fall can cause fracture, and if it is a light fracture and if it is not healed properly, then it can cause a bigger injury and that leads to bigger degeneration of the joint. Why surgery is so important? Because we need to walk. It's our day-to-day activity. And with a personal experience, I would like to mention that my mom had severe arthritis, and as a medical professional, we thought that we can avoid this surgery for the longest period of time. And what we observed is her quality of life started deteriorating. So that was a time that we realized that we have to realize that there could be another option to recover. And when surgeon explained us that this surgery is pretty much under control and the success rate is very high for this surgery and the rehabilitation, with the proper care and rehabilitation, the person get back to their normal lifestyle and normal life like 95%. The success of the surgery is pretty high, which is the data provides that 95% feel a reduction of the pain, 90 to 95% for next 10 years. They feel that their joint is pretty much mobile and they can walk around, do activities. 80 to 85% after 20 years of the surgery also, they feel they are active. But 100% what I suggest is team approach. Orthopedician, orthopedic surgeon, physiotherapist, occupational therapist are the key professionals who can make sure that the success of the surgery. Mythbusters about this surgery is I have heard a lot of time people talking about this surgery is worth avoiding. Who needs this surgery? Who needs walking? If I'm not able to walk, I'll be just sitting around for the rest of my life. Only old folks go for this surgery. I've also heard that I'm going to be restricted for my life. I've heard like I'm athlete, I'm fit, so if I go for this surgery, I will not be able to resume back my active lifestyle or maybe not able to run at all after the surgery. There are some explanations to it. The little bit of brief understanding regarding all these myths have to be understood. But overall, the success of surgery could be or would be in your hand. The professionals like us give you proper guidance. I wanted to share this one knowledge with you. According to recent data, we have found out, and again, in a clinical practice, what we find is hip issues or hip arthritis. It's not just like only present on one side gets affected and the arthritis gets gets involved in the other side of the joint as well. Just hip arthritis is not the primary issue. The secondary issue starts happening when you start losing the mobility, flexibility, and stretching ability around the pelvic area and pelvic fascia. So people start having back pain or scoliosis. Now, here is the thing that back pain causes hip arthritis or vice versa. Chicken or egg first? It's an eternal question and we don't know. But arthritis doesn't remain in one joint and it can affect different levels of the joint. Back pain and scoliosis are very concurrent factors or concurrent dysfunctions have been observed with hip arthritis or hip dysfunction. Also, what we find is diastasis recti, which is a weakness in the abdominal fascia, and it separates the two sides of the fibers of abdominal muscles, that is rectus abdominis, and that can cause weak spot in your abdominal wall, which can cause in future, if it is neglected, it can cause abdominal hernia, umbilical hernia. In future cases, it can also cause inguinal hernia. Leading to all of that previous issue, we can start having constipation. Because easy bowel control, you need strength around the pelvic girdle and proper mobility for the last part of the colon and rectum to move easily. Constipation is pretty much common in such cases. POP is pelvic organ prolapse. In case of females, it has been observed that because of weakness around the hip area or severe arthritis, there is no proper mobility going on in pelvic fascia, and the decrease in the blood circulation and metabolism around that area can cause a lot of issues like a pelvic organ prolapse as well. The ligaments gets weaker and there is no stability. Also, we have found that urinary incontinence and sexual dysfunction. I can explain you furthermore that why all of that happens. Because if you see, this is the inguinal region where the hip joint is now situated laterally. But if you can see that the vital nerve and arteries and the blood vessels, veins and blood vessels are actually present around this area, and it travels around this pelvic fascia and lower abdominal fascia. Also, our cremastic nerve and arteries. Also, we have the artery which supplies the testicle is also running from the same region. So this can explain the previous diagnosis along with it. Now the next slide shows that why does it happen that adductor region like the inner groin region has also a lot of nerve supply, and a main vessel which goes on to supply the femoral head passes from this area. So the adductor canal or inner groin area, people start losing their flexibility around the adductor region. They cannot sit open leg, or they cannot sit on the ground, or sitting on the toilet can be very difficult. And that could be alerting factor that probably they are losing the flexibility and vitality around the hip region and they have to consult. professional to find out like which artery, which nerve, which blood vessels, which what ligaments are actually getting injured or getting affected, which will cause you in long term going towards total hip replacement surgery or vice versa. So when people have arthritis, severe arthritis or damage to the cartilage or the bone surfaces, then they will start having a excruciating pain. When you're in so much of pain, it just blocks the muscles and a neuro circuit around that area and nothing goes right. So around that area, if you consider like the private part function or your abdominal function, that means digestion or like evacuation of the bowel or bladder, urinary continence, everything gets affected. So it's not just one thing at a time. It can actually get progressed to different levels, and that's why I believe that team approach is important to understand what all other secondary factors are going on in people who are actually waiting for the total hip replacement or just having a severe arthritis and probably they need total hip replacement. Who else can benefit you? That acupuncturist, massage therapist, kinesiotherapist, dietitian and nutritionist, and family. Yesterday, I was just talking to one of my great friend who's a holistic nutritionist, and she gave me a kind of idea that when she sees the patient who are going waiting for the surgery and they are just expecting their surgery to be in few months, they actually have consultation with her and have a proper protocol for their diet and nutrition so that they can do their weight management, obesity reduction, fat reduction, and also they can have anti-inflammatory diet so that pre and post surgery not having a lot of swelling or the tissue health would be in optimum level that they can heal themselves faster. Family members are very important to have a support and motivating them. Patients always ask me different types of questions like, what do you exactly do as a physiotherapist? And I always tell them that we have like a fixed protocol, and that is standardized protocol in our books actually, that every 3 weeks post-operative, what kind of treatment protocol we are going forward. And it's very bookish. It's very, very out there. If you kind of Google it and you will directly find that the whole protocol, and it's a pleasant factor that if I just Google it right now and you will find like a PDF like, okay, this day 1 you have to do this exercise, day 2 or week 3, week 4 this exercises, and it is such a structured protocol. We always try reducing pain and gaining some ADL function in the beginning of the first week or 2 of healing process post-operative. Then we focus on strengthening, but not directly with like weightlifting or anything, but we will start reactivating the muscles within 3 to 6 weeks, which is a good healing time where the swelling is reduced and the muscles are ready to function. And then balance and function rate training protocol after the 6 weeks, because the soft tissue healing has happened, and then we can move on to the balance rehabilitation where we need more of functional activity like walking. In walking itself, you do a lot of balancing. So to eliminate the fall risk also, we do that. There could be a long waiting period. Where I live in Edmonton, Alberta, Canada, and I was researching and we found that at least 2 to 4 years of wait period before you actually go for a surgery. So after the initial consultation with your general practitioner, X-ray and MRI investigation, and then if the damage is pretty severe, then your GP can refer it to orthopedic surgeon or orthopedician, and they start taking decision on you that how serious the injury or damage to the joint is, and what are the comorbid factors of yours. That means how is your health condition, how is your rest of the health, and do you need weight reduction, do you need that obesity management, because when you have obesity, then there is already a body mass is impacting that joint and we need to reduce that. If you have comorbidities like hypertension or diabetes, they will always try to bring that under control before they even suggest a date to you for the surgery. So there are a lot of factors involved in it, that how much you are waiting, but definitely you're waiting not less than 2 years, unless it is like a severe fracture and you have to go for a surgery immediately, so that the initial injury swelling would not cause any obstruction to the vital nerves and organs. So they kind of do this decision based on all of that. Pre-surgical assessment from the physiotherapist or a professional goes like this. It has a very structured protocol. We find it like every person is different. We find every person's the baseline level is different. So we document regarding posture. Then we check gait symmetry, how person is walking. Is one leg is shorter than the other? Then we measure that, and if it is a significant leg length discrepancy, we always ask them to go for orthotic readjustment, because that is very essential to deload or unload the joint which is excessively weight bearing. Upper extremity strength is also documented, range of motion, then pain level at around hip joint. But that's not the only hip joint. We check all the joints, proximal and distal, like upper and lower region. And we never leave one joint away. We actually check all the joints, and then significantly we check the spine and the hip, knee and ankle along with the hip. Strength of the lower extremity and the core muscle is super important, because these are the muscles actually are going to support the hip joint, which is going to be a renewed joint later on, right? So when the metal processes goes in the body, actually it doesn't have any receptors around it. That's the only problem. And then we actually do a lot of balance retraining. That's why we need to know the baseline balance, that how much balance is affected, how much receptors are affected and they are not functioning, before we actually think about post-surgical rehabilitation. So pre-surgical assessment is super important. Lifestyle assessment, because how the person is sleeping, what the person is eating, what is the lifestyle, eating, sleeping, breathing, the kind of stress level the person has, or all of that has to be documented, so that we do a lot of motivational counseling. All that fits in our structured health coaching. As a physiotherapist, we assume that role as well in pre-surgical assessment and treatment. Activity functional ergonomic assessment, because we need to know that baseline activity level, like the person is sedentary, like not active at all, or the patient is very, very athletic. So their performance or the activity level is documented. Functional capacities like lifting, carrying, pulling, pushing, their the baseline of their ergonomics, that how much the person has to sit or stand or walk. Now, why is it important? Because we have found that, some certain jobs like sitting for a long time causes hip degeneration. So that is not even surprise anymore. People are aware about hazards of sitting. Sitting itself has categorized into big limiting factor and or big comorbidity. Psychological assessment is also done, and just baseline psychological assessment. If the person really needs any further treatment or help, we can decide that previously. A lot of researches talks about the direct correlation of type A personality or under the stress people, and depression is directly proportional to the hip degeneration, which is not surprise, because depression causes less of mobility, less of function overall, and that causes lack of blood circulation and nutrition going on the big joints, and the big joints start suffering more, and that has been seen that to cause a lot of candidates for total hip replacement. What would you like in your protocol, that cookie cutter or personalized approach? Why am I asking? Because if you go onto the internet, you will see lots of data and lots of literally formatted exercises, like day wise, that which exercise to be done and what stage. And I really like that approach of Alberta Joint and Health, where there is a PDF format of all the exercises given, and you can refer it on internet. I can share the link with you at the end of the session. But what I found is personalized approach, because every person is different, and physiotherapist or a professional can understand not everyone fits in the same baseline. So when we assess everything and we document, there are differences found in each one's ability and disability. And again, we can talk about more how to gain that function, like, the length of recovery would depend upon multiple factors. We have to prepare ourselves. So surgery is an event. Surgery is an absolute big event in the life. Take it seriously, and we have to prepare ourselves. There are a list of things has to be done, and again, I can share the link where all the list is there. That what all things you require. The home environment has to be changed, non-slippery floor, and fall prevention strategies, and there should not be decluttering at your home. And again, you need those equipments and adjuncts like a grabber, the reacher, or raised toilet seat, and handbars, and crutch measurement is a big thing before even you think about surgery. And because immediately once you go for a surgery, the early mobility is required, and you need crutches for that. You need even walker for that. So the measurement has to be taken before the surgery. Then compression stockings and bolsters. These are so comfortable bolsters that it gives you leg elevation, swelling reduction, and less chances of complications post-surgery. What we need before the surgery is not just like stress on you, thinking what you're going to do, what the list of things to be jotted down, and who's going to help me, how is going to be my lifestyle after that. You don't have to worry about all of this. What you need is like mindfulness and meditation, and proper support from your practitioner. You don't need much of medication unless it is severe pain, but pain can be managed by a variety of things. And think about these other approaches, what fits best for you. Now, professionals like physiotherapist or occupational therapist can suggest you based on their assessment that you really need that popping so many medications, or just meditation can help you. The confidence from professional also can be stress relieving. So what you already need is professional training. So this is all beforehand the surgery. Okay, when you have severe arthritis, of course you need like gentle mobility exercises, stretching, therapeutic yoga. Weight management is a big thing. If you are considering to have optimal health and fitness, then you need to manage how much force you're impacting on the new implant. And then you need some good nice exercises for just range of motion, group therapy probably, to boost your motivation, to boost your overall capacity, and just clarity of your thoughts. And when you meet your own group of people who are also waiting for the same kind of surgery, it's stress relieving, or it could be more motivating for your rehabilitation goals. So it is a standardized goal setting. So we do help you as a profession that standardized goal setting. Pre-surgical treatment, when somebody comes in our door and the pre-surgical assessment is done, we advise them multiple things so that they can increase the vitality of the same joint. When the surgery happens, actually we in our academic years, we have attended those surgeries, and the surgery generally takes about like 2 hours or maximum 3 hours depending upon the complication, whatever that surgical hour is. And we have seen like different cases. Everybody's hip was different, right? So there are different levels of damages or muscle atrophy. We have seen like shrinking of the muscle, and then there is a lot of fat deposition, or you can say when you open up the joint area, that reveals a lot of information about the status and the quality of the joint or the soft tissue around that. And it is very important for you to even think beforehand that how I'm going to increase the overall blood circulation, nutrition, and flexibility around that joint, so that once you go for the surgery, it's not a horrible joint to see, right? Flexibility of the muscle is important as much as possible. Arthritis can limit that, but again, the pain modulation is up to professionals. We have different techniques, like we have deep muscle stimulator or superficial nerve stimulator, which causes pain reduction, improve the blood circulation around that area, and overall you can gain some more flexibility when you do exercises. We have heat pack, cold pack therapy, again to relieve that muscle pain or muscle spasms, and strengthening approaches and muscle activation. So we always understand what level of muscle activity you have, and then start treating that. Balance and postural control, fall prevention strategy. And this is strict protocol for every week or so. We actually increase the level and increment the level based on how much per person is progressing. We deal with a lot of fall prevention strategy training and overall balance rehabilitation. As I said, weight management, because certain aerobic exercises, unloading or reducing the joint damaging exercises, low impact exercises, and pain reducing offloading exercises, some mat exercises probably will be considered for your rehabilitation, which can cause that improve just health around that joint. Lifestyle management, we talk about how to sleep better. Okay, if you have that posture pain when you weight bear on the same side, if the pain is increasing, we always give you some strategies to sleep well, to avoid the direct compression on the joint, and putting some pillows between the thighs, and then bolstering so that you're not rolling onto the painful side, and that improves the condition of the joint. Aerobic exercises, as I said, that stationary biking could be considered, because treadmill walking or high impact hopping, skipping, jumping activity can increase the degenerative process and pain. Mat exercises are the best exercises, and you can actually sweat in mat exercise. Not to consider like only weightlifting is the type of exercise. A lot of people come to me that they are addicted to the gym and they want that to do the deadlifts, and then only then they feel like they are doing some exercise. Apart from that, if they don't touch the equipment, they don't feel like they are doing exercise, which is a fun fact actually. We believe in different types of individualized muscle activity protocol, and only professionals or a physiotherapist can understand which muscle is weaker in you, and then they target and they make you do certain repetitions, right? Cognitive behavioral visualization technique always works best to reduce the level of pain what you have. Relaxation, breathing exercises, what we suggest, and we always monitor people for their stress management, and we motivate them for preparation of their surgery. Now, preparation is always good because hip don't lie, hip talks about your personality, or hip talks about how much, confidence you're going to have in your life after that, because it does give you a lot of balance and activity control, right? So once the hip gets affected, we feel debilitated, and to remove that, preparation is the key. And documentation for our side, because we always like to know that how we are progressing. So when we have assessed you, so you are going to be an individual person for us, and we document. At the time of surgery, nothing much, just relaxation, meditation, and obviously you're going to be under the anesthesia. But as soon as you are coming out of the anesthesia, you can expect the pain to be spiked, because it's elective trauma which you're going for. If this is a minimal invasive surgery, then they don't remove too much of soft tissue. They actually just peel off, or they kind of move them aside, and then they approach again. But still, it is going to be a soft tissue injury around that area. If it is a big scar on you, you can think that your rehabilitation consultant can give you ideas to reduce the scar tissue, or improve the vitality and reduction of the swelling, and improving your wound healing. Now, as soon as you come out of the surgery, yes, within 24 hours, you can start your exercises. Yes, we start with like upper extremity mobility, just simple breathing exercises. And for us, giving you confidence that you can move is very important. The cliche or the physio meme, what we always see that physios are like making you walk after the surgery. Like we actually see that a lot of time that they say that physio come after the surgery, and the first thing they do is make you walk. Now, early mobility is one of the very important treatment protocol for sure, but this is not the only thing. Before you can even step onto your post-surgical hip, what we find is we guide you for do's and don'ts, right? We tell you what to do and what not to do. Now, crossing the leg or deep squats or deep knee or hip bending or high impact activities are complete, don'ts or completely avoiding activities. But at the same time, we tell you what to do after the surgery. So first thing to do is, yes, you can start moving the joints which you can move, like neck stretches, breathing exercises, just overall relaxation of the upper body. And then no spine movement, because obviously when you rotate your spine, there could be mobility at your hip. So any rotational component to the hip has to be avoided. So we teach you log rolling, how to move safely in the bed. And bedside exercises are a precursor of the better success for your surgery. So the damage can happen within that few weeks when you're healing. So post-surgically, we are protecting you from damaging the architecture of the new joint. Wound healing, swelling reduction is up to us, and we do a lot of, like, probably if it is needed, like ultrasound therapy or just manual mobilization, soft tissue release, or just cold pack therapy or RICE protocol. RICE is rest, ice, compression and elevation. So we talked about the compression bandaging, and we train you how to wrap around the swollen leg. And we always ask you, the first thing to do is ankle pumping. That means move your ankle up and down so that there is no chances of you developing thrombosis or the blood clot in your calf, which can go up to your lungs. So that's why breathing exercise is also important. Early mobility and weight bearing as tolerated, absolutely important. So weight, as soon as you are out of the surgery, the first target is to give you mobility and confidence, right? But your muscle has to be healthy, the re-education of the muscle. So as soon as you're in the bed after the surgery, we reactivate them. We just ask you to contract your butt and relax, and maybe push your knee down and hold it for like a couple of seconds and relax. And that repetition gives your muscle confidence that they can work. Of course, they are not very strong, but slowly and steadily, we go ahead and make them stronger. Stair climbing is the criteria to discharge from the hospital, and we kind of educate you regarding how to use crutches or a walker according to your status. And if we are able to do that functional activity, there is a time for you to get discharged and go to the outpatient rehabilitation. Aerobic exercises, yes, some of the just spot marching exercise or just moving your knee up and down exercises would help you. Mini squats can be advised as soon as you start taking weight, and with the support, and then without the support. Our long-term goal for the rehabilitation would be always absolute balance recovery, because we don't want you to fall. Fall prevention is the biggest thing what we look at, and we assume that there should be no impact or injury. Improving overall fitness and well-being is very important. So we look into that, and we kind of devise an absolute protocol looking at your condition, how you're recovering. And every 3 to 6 weeks, we monitor you. So personalized therapy or personalized rehabilitation is very essential. Function modification and recovery is essential. We were reading about the research, and I come to know that currently there are lots of material online which gives you a structured protocol for the hip rehabilitation post-surgery. But nobody talks about pre-surgical rehabilitation, and the research backs up this issue that pre-surgical rehabilitation is essential, and that gives you best result. So pre-surgically, if you are going through massage therapy, acupuncture, physiotherapy, all of that benefits you, how you're going to progress after the surgery, how you're going to get better, or how faster you're going to get better and active post-surgically. How to prevent is one of the major important thing. I'm an honorary member of lifestyle medicine. What I have found is meditation, relaxation, just breathing and relaxing your each body part is essential to reduce the joint inflammation and degeneration. The research backs up with arthritic condition is directly proportional to the mental stress level. So it's just the hyperactivity of the whole neuronal circuits which causes the deactivation of alpha motor neuron. So the mobility, the smooth movement of the muscle is restricted because you're under the stress, which just damages the whole loop. That central nervous system or the autonomic nervous system is always firing on this stressed muscle, and their overall activity of the performance level will decrease. When the muscles are too tight, obviously when there is a hypertonicity in the muscles because of the hyper stress level or hypertension, that could cause the loading forces or the tightening forces or compression forces on the joint, which can reduce the joint space and it will degenerate faster. So how to reduce the degeneration is up to you. So research backs up, and there are a lot of articles in the present which will talk about just overall body relaxation. Either it is a cognitive behavioral technique or just approach any professional and ask them how. Doctors can guide you, physiotherapist, occupational therapist, kinesiotherapist can guide you. Sometimes we treat the stress with a mobility. So some people come to us with a high stress level, and we check what's their goal, what would they like to do in their life. And when the goal is set, we make them achieve those goals. We actually jotted down the small steps involved in that goal, and that boosts their confidence level that I could achieve that. For example, if you start losing interest in playing with your grandchildren, that's not okay. If you think that just sitting in a recliner chair for rest of your life is going to be okay for you, that's not okay. And once you start understanding that, we kind of give hand, and our interview can make you feel comfortable setting your goals, that what you would like to do to make you feel happy. And now the reverse action happens. When you are happy, you just secrete that neurochemicals or neurotransmitters, which releases the muscle tension and which relieves the choking pattern on the joints, and the joint starts breathing. I always talk about this in neuronal circuits to reduce the damage on the body. So it could be internal visceral damage, or it could be outside the joint damage and muscle damage. So the people who are like stressed, they have a higher tendency to fall because they cannot do multitasking, or they cannot recover from the balance, and their body is not flexible. So they tighten more than relaxing, and there is no shock absorption. So again, when you have serious arthritis, receptors are damaged, and obviously it will give you less of balance control when you're the vision is obstructed as the age progresses, or you don't have a good vision, good hearing capacity, or joint flexibility. Then there is overall fall issue, and then injury. And then again, even if it is not a big fracture, even if I have like micro traumas around your joints, it is going to cause more inflammation and more degeneration at your joint and capsule level. So here is the thing. There are a lot of ways you can prevent it. Just prevent by taking a quick measure and earlier measures as soon as any micro trauma happens, and just go and consult either doctor or a physiotherapist or a professional, so that just to rule out that you didn't damage more than what you thought. And the early healing will help you to prevent further damages. There is a nice article on clinical journal on brain and pain, and how actually pain is derived by brain activity. So our brain tells us how much pain you are feeling. So that perception of the pain is in the brain, and how we modify that according to current researches. And it has been found that you can actually modulate or tune down the pain level with a lot of brain training. So it could involve mindfulness, meditation, general breathing exercises, a visualization technique, and just feel good targeted exercises. Exercise gives you that serotonin and endorphin release, which causes more confidence and more mobility. When you move more, you feel better. Arthritis and personality. There is great articles. Type A personality and depression is directly proportional to the arthritis. So some metaphysics, they talk about you store your stresses in the joints, and there are a lot of articles on that. How directly the neuronal circuits gets affected, which causes activation or deactivation of the proper channels, and there is no coordination going on in your joints or muscles around that area, and obviously you start losing vitality. And it has been found that pelvic girdle, hip area, is degenerated because of different kinds of personality types. Now there are articles on should you go to physio, or should you just do your exercises by yourself and you can get better, because there are a lot of articles and cookie cutter exercise protocols out there on online. Should I just not follow that and get better pre-surgery and post-surgery? And absolutely there is a non-significant difference that has been found, that even if you don't go to physio, you're going to get better. But now individually, what comorbidities you have? Do you have diabetes, blood pressure, or what is your capacity? Have you like sprained your different joints, or if you have any other secondary factors that would be missed if you're following this cookie cutter exercise protocol plan, which will benefit you lesser if you have any other comorbidities, because that can shoot up your blood pressure, that can actually damage your vessels around the inguinal canal if you have inguinal hernia, or if you're doing some exercises which are not good for your core muscles. So hip is a transition point from the upper body to the lower body, and there are vital things are attached to the hip joint, and we need to take care of them, and professionals will always be conservative to tell you what not to do and what is best thing to do when you go to them. Factors for the long life of prosthesis. So there are multiple factors, which is like continuously being active and relaxation actually. So what works best overall? With a lot of researchers and various data collection and analyzing the recent advances, the three things we can jot down is following the pre-surgical rehabilitation, because you make your joint better or healthier beforehand, before you go for that big surgical trauma. Lifestyle change, yes, very important. Sleeping better, eating healthy, meditation, breathing practice, and overall staying happy and psychologically well will help you to take you to the health to the next level. Being active and motivated, that really helps. There are articles which says that just tell the patient what not to do, like crossing the leg or deep squatting or something, and then only give them exercises what they feel like doing, and early mobility, like early if they move out of the bed and start walking and doing things what they want within the parameters of restriction, that makes them feel happy and confident, and they get better faster. So just be motivated and be active. Don't be worried about factors which will like sabotage your recovery. You can actually go to professional and ask them questions, and they're here to help you. I'm concluding by summarizing the key points of my presentation. We, the professionals, and all of the professionals which I talked about, can make you feel confident pre and post surgery to regain your health, fitness, happiness, and life back. I guess I have covered all the points which you needed to be answered. And if you have any further questions, I'll be always ready to help you. Just call at Vertex Physiotherapy and Performance Center, and the number will be displayed on my presentation, and I will be more than happy to help you so that I can tell you the tips and trick in a personalized manner. I always like to talk to people in person so that I can give them best guidance. If you have any questions, you can shoot a call and chat with me. Thank you very much.